If you take your blood pressure pill with your morning coffee, pause for a second. And if you take your water pill after 2 p.m., the same goes for you. Today we're going through the most common timing mistakes with blood pressure medication, the ones that reduce how well the drug works or create a real risk, and what to do instead. Before we start, if you find this useful, subscribe to the channel. A quick note before we begin. This video is for informational purposes only. It doesn't replace a medical evaluation, and every piece of data you'll hear has been checked against the original scientific sources. Mistake 1. Timing your dose, morning or night. For decades, the standard instruction was once a day in the morning. That wasn't based on strong scientific evidence, it was simply convention. Blood pressure follows a natural rhythm. It drops during sleep, then rises sharply in the early morning hours, what's known as the morning surge, the window when heart attacks and strokes are most likely to happen. Some studies have found a cardiovascular benefit to taking the medication at bedtime, because it stays active right through that vulnerable morning window. But let's be honest here, the science on this is still evolving. Some studies show a clear benefit to bedtime dosing, others find no significant difference. The right answer depends on your specific medication and your own blood pressure pattern. The question worth asking your doctor is simple. Should I be taking this at bedtime instead of in the morning? If they can give you a personalized answer, great. If they've never thought about it, that tells you something too. Mistake 2. Grapefruit, but only with certain medications. Grapefruit contains compounds called furanocoumarins, which block an enzyme in your gut called CYP3A4, responsible for breaking down several medications. When that enzyme is blocked, the drug doesn't get processed normally, and its blood level can rise 2 to 4 times higher than intended. The result, an excessive drop in blood pressure, dizziness, fainting, in some cases dangerous arrhythmias. What makes this interaction especially serious is how long it lasts. The effect of grapefruit can last 24 to 72 hours, so even a glass of juice in the evening can affect the medication you take the next morning. The reason the effect lasts so long is that furanocoumarins don't just temporarily occupy the enzyme, they deactivate it almost permanently, and your body has to build a new one from scratch, a process that takes that same 24 to 72 hours. That's why spacing grapefruit and your medication apart by a few hours, the way you might with other food interactions, doesn't help here. The only real strategy is avoiding it altogether if you're on one of the affected drugs. But here's where precision really matters. Not every blood pressure medication interacts with grapefruit. Among calcium channel blockers, drugs like felodipine, nifedipine, and amlodipine have the strongest interaction. ACE inhibitors like lisinopril, ARBs like losartan, beta blockers like metoprolol, and diuretics like hydrochlorothiazide are generally safe with grapefruit. If you're on a calcium channel blocker, ask your pharmacist directly whether grapefruit is a concern with that specific drug. Don't assume the answer is no. Mistake 3. Taking your diuretic too late in the day. Diuretics, the so-called water pills, make your kidneys release more fluid, lowering blood volume and therefore blood pressure. The timing problem is simple. If you take your diuretic in the late afternoon or evening, its peak effect hits right during the night. The predictable result is getting up multiple times to use the bathroom in the dark. This isn't a minor inconvenience to just accept as normal. Studies on older adults show that getting up at least twice a night to urinate significantly raises the risk of a fall with fracture, in some studies nearly doubling it, and it's also linked to a higher risk of death in the year following a hip fracture. Here's a detail most people don't know. If your doctor has ever suggested moving your diuretic to the evening for some other reason, know that some studies show this actually increases how often you need to urinate at night, the exact problem you're trying to avoid. It's not a universal rule for every clinical situation, but it's why, unless your doctor says otherwise, morning remains the safest time for most people. The practical rule is this: if you're on a diuretic, take it in the morning, ideally before 10 a.m., so the peak effect runs through the day, not the night. If you take a diuretic twice a day, the second dose shouldn't be any later than 2 p.m. Mistake 4. Salt substitutes, if you're on an ACE inhibitor or ARB. Many people with high blood pressure switch to salt substitutes to cut back on sodium, a generally sensible choice backed by good research. The problem is that these products replace sodium with potassium chloride, and if you're taking an ACE inhibitor like lisinopril or an ARB like losartan, you're already on a medication that tends to raise potassium levels on its own. UK clinical guidelines from NICE specifically recommend avoiding these salt substitutes in older adults, in people with kidney disease, or in anyone taking these exact medications, because the combination can push potassium high enough to disrupt your heart's electrical rhythm. The risk grows further with age, since kidneys naturally become less efficient at clearing excess potassium, often without the person noticing until the problem is already real. If you use a salt substitute and take one of these two medications, that's worth mentioning to your doctor, especially if your kidney function isn't perfect either. Mistake 5. Coffee and beta blockers, the same time of day. Many people taking beta blockers, medications like metoprolol, also have their morning coffee at the same time or shortly after. Caffeine stimulates the nervous system, temporarily raising heart rate and blood pressure. The beta blocker does exactly the opposite job, slowing the heartbeat and reducing the force of the heart's contractions. When you take them together, you're pressing the gas pedal and the brake at the same time. One detail worth clarifying here. Research shows this isn't an interaction that changes how much of the drug is in your blood, it's more a case of opposite effects on the same system. In most people, the medication wins out and nothing significant happens. But in people with a history of cardiac arrhythmias, the combination can trigger palpitations or irregular heartbeats during the window when caffeine peaks, roughly 30 to 60 minutes after you drink it. If you're on a beta blocker and have a history of arrhythmia, wait at least 30 to 45 minutes between your medication and your coffee. It's a small change that can make a real difference. Mistake 6. Doubling your dose after a missed one. It happens to everyone. You miss your morning dose, you realize at lunch or at dinner, and the instinct is to take two together tonight to catch up. For some medications, this carries low risk. For others, particularly calcium channel blockers, certain ARBs, and beta blockers, doubling the dose can cause a sharp drop in blood pressure, dizziness, fainting, and in older adults with less elastic blood vessels, a fall. Not every medication behaves the same way when doses are missed or doubled. Amlodipine, for example, stays in your system for a very long time, between 30 and 50 hours, so missing even 2 doses in a row only lowers your blood pressure by a few points. It's one of the more forgiving drugs when it comes to occasional slip-ups. Beta blockers, on the other hand, carry a different and more serious risk if stopped abruptly after long-term use. Your heart can become temporarily more sensitive, with a rebound effect that can last up to 2 weeks. That means the exact same missed dose can have very different consequences depending on the specific drug. One more reason not to handle it on your own using a single rule for everything. There's also a quieter version of this same mistake. People prescribed a twice-daily medication who start taking it only once a day because it's easier to remember, without telling their doctor. Blood pressure looks partially controlled. The doctor sees acceptable numbers, but the cardiovascular protection the medication is supposed to provide stays incomplete. The standard guidance is this: if you realize you missed a dose the same day, take it as soon as you remember, unless it's close to your next scheduled dose, in which case skip the missed one and go back to your normal schedule. Never double up without checking with your doctor or pharmacist first, because the right answer depends entirely on which medication you're taking. One last practical thing, maybe the most useful one in this whole video. What happens to these medications when you get sick, even just a stomach bug or a few days of fever? When your body loses fluids from vomiting, diarrhea, or heavy sweating, ACE inhibitors, ARBs, and diuretics can become a problem at exactly the moment your body can least handle it. Dehydration reduces blood flow to your kidneys, and these medications, which already act on that system, can make the damage worse, up to acute kidney injury. Because of this, several UK clinical guidelines recommend what's called the sick day rule. If you have vomiting, persistent diarrhea, or a fever high enough that you can't drink normally, these specific medications, along with anti-inflammatories like ibuprofen, should be temporarily paused until you're back to eating and drinking normally, usually for 24 to 48 hours after you recover. This isn't something to decide on your own, it needs to be worked out with your doctor ahead of time, not in the middle of an emergency. The question to ask today, before you ever get sick, is simple. If I get vomiting or diarrhea, which medications should I temporarily stop, and for how long? Blood pressure medication saves lives, and the evidence behind treating hypertension is among the strongest in all of cardiovascular medicine. Nothing you've heard today is a reason to stop your medication or think your doctor got something wrong. What's often missing is exactly this conversation about when to take it, what to take it with, and what to do if you miss a dose, a conversation that rarely fits into a short appointment. Here are the questions to bring to your next visit. Should I be taking my medication in the morning or at night? Are there foods, supplements, or drinks I should avoid around my dose? What should I do if I miss a dose? Is there a time of day my blood pressure tends to run highest? What should I do if I get sick with vomiting or diarrhea? Are there any timing interactions with my other medications? Asking these clearly will do more for your cardiovascular protection than anything a video can tell you, because your doctor has access to your full medical history. If this video was helpful, leave a like. If you have constructive feedback for me, write it in the comments. Lastly, subscribe to the channel to stay updated, and see you in the next video.